to meet you. Thank you. Thank you for being here. Okay, now for rest of you, if you haven't downloaded the PDF yet, I'm going to stop it right now. I'm going to turn it to PowerPoint. So I will share it again for the PDF. You'll be able to download it later. Okay, our topic tonight is scalp acupuncture by Hui 12 points. Okay, to balance 12 meridian. By Hui means 220. 220. Okay. Now, before I start this webinar, I want to thank Daisy and Kenny. So Daisy and Kenny both been helping me to set up this webinar. They volunteer. Then they organize, if you're from New Zealand, you need one of the acupuncturists from New Zealand or all around the world. And if you need a certificate from this webinar, and Kenny will actually create the certificate later on. We'll give Kenny say that about 2 weeks time, then he will make sure that the certificate will up online on our Facebook group. So the only way to get your certificate is join our Facebook group. Okay. So go back to the email before. Go back to the email that you receive or Facebook that when you first click the link and sign up for this webinar, there's a second link that you can click. Then to join our Facebook group, okay? And Daisy helped me to put things together as well. So thanks, Daisy and Kenny, for all your hard work. Thank you very much. Hi, Iman. How are you? Is that Kenny as it's Kenny Chen? Yes, that's Kenny Chen. Jimmy. Thank you. Right. Let's start then. Okay. So can you all hear me and see me? If you can see me and hear me, please reply 1. Jamie said, yeah, I went to school with Kenny. Oh, yeah. Yes, Malaysian too. So I'm from Malaysian, but I immigrated to New Zealand for 14 years. Right, for 14 years. Oh, great. So all can hear me and see me. That's great. Thank you very much. Hi, Karuna, how are you? Good. All right, let's start then. So this, Sume, how are you? This method is so easy. It's so easy. I'm going to show you how to needle it. I'm going to show you where the theory is. And when you apply the theory, you're going to use your own diagnose. Okay. So diagnose is the most important things. The most important. If you diagnose wrong, hey, it's not going to work. Okay. Now you can use your own diagnose. You can use meridian diagnose. You can use asking question and collect information and to figure that out which organ is come from, to figure out which meridian it belongs to, then you need it. Okay. Then you can look at the tongue and to tell which organ is problem, then you need it. Okay. So it doesn't matter how you diagnose it. Okay. What method do you use? Okay. I use pulse all the time. Okay. And you can just ask patient where about the pain and figure out which is the sick meridian. And according to the sick meridian, and then you needle the direction. You point the needle to one direction to that meridian. Then it will work. Okay. And it's so simple. It's so simple. It is on 220. Yes, it's on 220. Hi, Jordan. Hi, Marika. How are you? Okay. Now, all right. I'm going to keep going. Well, this is 220. Of course, it's in Chinese. I know most of you can't read Chinese. Let's skip. This is in English. Okay. First, how do we locate Bai Hui point? How do we locate Du20? On the head, well, this is the location. On the head, 5 chun directly above the midpoint of the anterior hairline, or at the midpoint of the line connecting to apex of the 2 auricular. Right. So the simple one, okay, I want you to do it yourself too. The simple way is flex your ear to the front, and this is the tip of the ear. So from here up to here, and then you draw a line between your eyebrow. Let's yin tang, right? From yin tang, go ahead to there. Okay, normally we say, well, this is the junction between from the ear up and from the middle between the eyebrow go up. That is Bai Hui, right? Right. If you go there, that's not how I locate the Bai Hui. When I needle my patient, this is the way that I go through. The quicker way, that you don't go actually 5 chun from the midpoint of the interior hairline. We don't go that way. We want a quick way, fast way. Okay. Then what happens is, when you go there and there, you move toward to your back, to the neck. Go there a little bit, and you find there's a depression. There is a depression. You know, some of you may find that the depression is quite obvious. Some of you not really. If you find a patient, some are just a little bit down there. Some is very obvious. You go there, doop, and it came up. Some are just, doop, So you go there, doop, very obvious. Some you go there, and it quickly go up. It's a very small one. Try it yourself. Can you get it? So when you go there and you press on the depression, on that depression is much tender, much sensitive than the others. So you press at that depression and you press that around and compare. Is it more sensitive than the other? I'm meaning that the depression that you're pressing on is more sensitive than the other. You may find a few depression, but get the most sensitive one. And normally when you go there, like from the ear, both ear up, and in the middle of between your eyebrow up, and the first depression, you press it. Can you all get it? Can you all get it? Yes. Do you find that is more sensitive than the others? That is what we're talking about, Bai Hui point. And this is where we treat. This is the point at where we treat. Okay? Well, can any of you that you can't get it, let me know. If you want me to repeat, I'm happy to repeat it again. Burning sensation. That is cool. That's fantastic. You can get burning sensation. That's not sensitive. Okay. Not as sensitive, but can you find the job? That's fine. If that's not as sensitive, that's okay. But you can find the depression, right? And that is the one. Not everyone can get sensitive. Some of them, if you treat your patient, you go to the depression, that's Bai Hui, right? And you press on it. Some patients say, no, nothing. There's nothing. They can't feel anything. And that's okay. It's just behind the highest point. Yes, that's right. Just behind the highest points. Yeah, all good. Thank you. Seems like everyone's okay. Any of you can't get it? Any of you can't feel it? It's sensitive too, and still when I remove my finger, still I can feel it, like burning strong. Okay, all good, all right? All good, right? There's no question, right? And here, I want everyone on the same page. This is a step-by-step one. Okay, I want to make sure all you're good. How far back is it? Not far at all. The highest point, you go to the point that is pumping up and you go back a little bit, it drops down. As soon as it drops down, that is the point. As soon as it drops, your finger go there, it drops, that is the point. And that point is supposed to be a bit more sensitive than the others. You can press the higher point, you can press the dropping point, and then you feel it. The lower point, the depression point, is much sensitive than the higher point. Does it make sense? Okay, good. We're all on the same page. Okay, this is where we're going to treat. We're using one point to treat the entire body. Okay, now what is the classification? Crossing point on the two vessels with the 6 yang meridian. You see, all 6 yang meridian cross on one point. What is 6 yang meridian? Stomach, 3 foot yang, stomach, gallbladder, bladder, 3 organs, right? Full organs. What about the hand? Sanjiao, which is triple burner, small intestine and large intestine. Those 6 full organs are crossing onto Bai Hui point, which means by using Bai Hui, we can treat all the 6 meridian. Does it make sense? Okay. I don't know whether you heard about that Bai Hui point has got another name called San Yang Wu Hui. San Yang means foot 3 yang and hand 3 yang. San means 3 yang. Foot 3 yang and hand 3 yang are close to this point. It's called San Yang in Chinese. So now we know San Yang is 6 full organs across to the Bai Hui, and Wu Hui, Wu means 5. Hui means meeting, meet together, Hui. So Wu actually means Wu Zhang. Wu Zhang means 5 Zhang organs. So San Yang Wu Hui means 3 hand yangs, 3 foot yangs, and 5 Zhang organs meet in Bai Hui point. Does it? What does it mean? It means that Bai Hui 220 will be able to connect to all Zhang organs and full organs. On another hand, we know that if any of the organs imbalance, we can use Bai Hui 220 to treat it. Does it make sense? Can you all follow? If you can follow, please reply 1. If you're not understanding what I'm talking about, please say 2. So that's in the classic book what Bai Hui means, what 220 means. Okay, good. Now, Look, what can Bai Hui treat? Bai Hui Du20 can treat vertigo, dizziness, right? Headache, prolapse, insomnia. It can treat diarrhea. What can Bai Hui treat? Can you name few? In your knowledge, what can Bai Hui treat? High blood pressure. Great. The function of Bai Hui, we all know that raising young, treat polyps, right? Anxiety, depression, right? Anxiety and depression. What else? Let's calm the sun, right? That's the function in here. Vomiting. You see, you guys know it. It can treat vomiting. It can clear the wind to treat dizziness. It can raise the young. What else? What else can Bai Hui? What do you use? Well, you use it. Prolapse organs, you see, prolapse organ, Parkinson's, migraine. 90% of the time you use Bai Hui. Look, hemorrhoid, stiff neck, fatigue, miscarriage, mental disorder, foot problem, anus issues, focus and memory, yeah, psychological disorder, epilepsy, dementia, menstrual problem. Well, you name it. Infertility. Look, it seems like Bai Hui can treat everything. Am I right? Mind clarity. Bai Hui can treat everything. What? If Bai Hui can treat everything, let me ask you a question. If Bai Hui can treat all meridian, can treat all the organs imbalance, then let me ask you a question. The question is, we know stomach, we know the meridian cover the full body, right? If pain in large intestine here, if pain in the shoulder, on the right side of the shoulder, and the large intestine, would you use Bai Hui point for it? I'm traveling and have a very bad connection. Is there a possibility for watch? Yes, you can watch it later on. I'm recording it now. Nicole, no problem at all. Yeah. No, perhaps to a specific. Yeah. Myro scalp shoulder. Yes. Okay. Now, let me ask you a question. Would you consider using Bai Hui for shoulder pain if it's under large intestine? Would you consider to use Bai Hui point for knee pain if it's in the stomach meridian? Would you consider use Bai Hui for lower back pain if it's in gallbladder meridian? Would you use Bai Hui point for ankle pain if it's in the kidney meridian? More or less use 220 for every client in combination with other point. Yes, and have used it in pain everywhere. That's great. Yeah. So normally we use Bai Hui, we use a combination point, right? We use other point together, right? Now, let me ask you a question. Do you use Bai Hui point, just one point, to treat all the organs? If I said you just use Bai Hui point and to target stomach meridian, would you be confident to tell me that, yes, I'm going to needle here and that's going to go to the stomach meridian? Can be used as a treatment. The governing point, yep. It comes difficult, right? Can we just put needle and say, well, that's it? Not a single point. Yep, that is my point. If we just use single Bai Hui point, now my question is, we know Bai Hui can connect to all the organs. But if I just put one needle in there, I say, well, this is going to treat your entire body. But the patient said, well, the pain's still here. The pain's still there. It doesn't work. What would you do? Yep, okay. Good point. Not confident enough to use it, to just use it alone. Okay, good point. This is what I want. This is what I want to know. Okay. Now I can use Bai Hui point for anything. For anything with just one point, with a different direction. Because different direction, point to different direction, it actually go to different meridian. And how do I know that? Okay. I never used alone in this case before today. Okay, now I'm going to show you. I'm not saying you can try it, just use single Bai Hui point and go to any pain, okay? But of course, sometimes it works very well, sometimes not working very well, and then you can add other method, and that's not a problem. Okay, I'm not saying that using Bai Hui point to treat the entire body and you just use Bai Hui point, you can't use any others. And that's today's I'm sharing with you with 220 to treat the entire body, just letting you know that how 220 can link to all the organs. And this is another solution for you, another way to treat the body. So when you come to treating Bai Hui, you know you want to go to stomach meridian, you can go to which direction. You want to go to, we're going to treat the spleen, you know you want to go to which direction. It work better, put it that way. Okay, so you can combine Bai Hui today's courses with any method. Okay, this is in Chinese, and that's in Chinese. Don't worry about it. Okay, come to here. Okay, have you heard about heavenly stream stem and earthly branches? 天干地支. Can you use it like navel? Yes, you can use it like navel. Okay. Ten heavenly stems are 甲乙丙丁戊己庚辛壬 and 癸. And 12 earthly branches are 子丑寅卯辰巳午未申酉戌 and 亥. Okay. If you have no sound, I'm not quite sure how to help you, because everyone listen to it. It might be you probably have to log out and refresh it again. Yes. This is a branch. Okay. So this is the main thing in here, and this is branches. You see, this is the branches. And this is the stem. Okay. So there are 10 stem, 12 branches. 10天干 12地支. Now we have 5 organs and 6 food. 5 zang organ, 6 food organs, right? Times 2. 5 times 2 become 10. 6 times 2 become 12. So we are using here with 12 脏腑. 12 脏腑. Now when it comes to 五运六气, we'll talk about more about 天干 and 地支. I'm just letting you know what's going on in here. So as early as 2069, 697 BC, when the Chinese ancestor Huang Di founded the country, he ordered the Da Nao to explore the qi mechanism of the heavens and the earth, explore the 5 elements, metal, wood, water, fire, and earth, combine each heavenly steam, 甲乙丙丁戊己庚辛壬 and 癸, paired with an earthly branch, which is 子丑寅卯辰巳午未申酉戌 and 亥, to form the 干支 cycle. Okay, so 干支 is 60甲子 60 干支. This is the Chinese way, the very ancient Chinese way, use 天干地支 for the years. Okay, let's have a look. The 12 earthly branches and Jupiter, right? That's Jupiter, right? Am I right? Must be. Earthly branch refers to the 12 parts of Jupiter's orbit, which are denoted as 子丑寅卯辰巳午未申酉戌 and 亥. So Jupiter's revolution period is about 12 years. So in ancient China, Jupiter was used to record the year. So how many months we have? 12 months, right? So the earth branch is actually from the Jupiter. I hope I pronounced it right. I never heard about that. I just made it up, probably. Now, this is in Chinese, it's easier for me to explain. But anyway, this is where the 12 earthly branches come from. Okay. So you know that is related to the star. Okay. Now, do you know the Chinese clock in the old time? We use 12. We have 12 时辰. And one 时辰 is equal to hour. We have 24 hours, right? We have 24 hours. But in the old time, we only use 12 时辰. We don't say about hour. So the hour, if you can see the picture, this is the old time. They put it under the sun and look at the shadow. And when the sun moves and you have different shadow points in different area, and with shadow points to what area, and it will be that 时辰. Okay, similar, very easy. So we were using 时辰子丑寅卯辰巳午未申酉戌 for the clock. Then that is 12 时辰. The Chinese clock in here. I know you don't read Chinese, but let me point to you. That Wu, which means the heart, as you can see, the midday. On the top, that's midnight, right? So the midday is 50. That means 11 to 1 o'clock, 11 to 13. That's 50. And the opposite one called 子时, that's 11 to 1 as well, but that's a midnight. That's midnight. Right. Now, anyway, this is just showing you 1 时辰 equal 2 hours of the current time that we are using. Yes, the clock is upside down, isn't it? But you look at the PM and AM. 1, 2, 3, 4, 5. And that's the right one. Because when I got to this logo, and it put midnight on the top, midday on the top, and midnight on the bottom. So I turn it around. So look at that way. But this is the correct way to present. Okay, this is the correct way. This just showing you 2 hours equal 1 时辰. So we have 12 时辰. Let's say if we have 12 时辰, we have 12 meridian, right? Am I right? How many meridians do we have? We have 12 时辰, right? And the 12 时辰is 12 meridians. So pair up with 12 meridians. And look at here. Between 11 to 1, 11 a.m. to 1 p.m., that's called 子时. And that's on the south, pointing to the south. And it pair up to the opposite called 子时. Now you can't see a 子时in here because I didn't put 子时down, but the 子时is 11 p.m. to 1 a.m. That's called 子时. And 子时is paired with gallbladder. Are you familiar with 子午流注? What is the blood and qi circulate in 12 meridian? Which meridian start with? May I ask you a question? Are you familiar with the blood and qi circulate between 12 meridians? Lung, right? Yes. And the next one is lung. The next one is large intestine. So lung, large intestine, stomach, spleen, heart, small intestine, bladder, kidney, pericardium, triple burner, gallbladder, liver, and back to lung again. Am I right? Are you familiar with this? If you have no idea of this, that's very difficult for you. Then I'm gonna make sure you know what I'm talking about. If you know this, it'll make things so easy in here. Now, any of you not sure about this qi and blood circulate between the 12 meridians? Yes, familiar, right? That's good. Not sure, Henry. Yep, no problem. If you're not sure, just let me know you're not sure. Otherwise, I'll skip this and you're going to miss a lot of things in here. Good. Not sure. Okay. If you're not sure, I'm here. I know a lot of you are familiar. That's great. That's going to help a lot. For those you're not sure, let me share with you in here. Let me share with you. Now, it's called 子午流珠. It started with lung. Okay. If you look at the discharge, on your right side, between 3 p.m. and 5 p.m., well, you will look at this discharge upside down. So the reading is upside down, okay? 3 to 5 p.m., that is lung. So it means the qi and blood come to 3, when it started in 3 p.m. to 5 p.m., it ran in the lung meridian. When it started at 3 o'clock in your lung meridian, it finished in the lung meridian at 5 o'clock. Then it's going to jump to the next meridian, which the next meridian will be large intestine meridian. And that is started from 5 a.m. to 7 a.m., large intestine meridian. Okay, now 3 a.m. to 5 a.m., that's 2 hours, right? And that's 1 时辰. That 时辰called yin. Remember, we go back to 12 branches. It's called yin shi. And here, you can see the yin mao chen si. That here too, we mentioned in, not in here. Yeah, the 12 earthly branches are 子丑 yin, yin. Okay, yin is 3, 2, 5. Okay. 3 a.m. to 5 p.m. is lung. Yeah, not p.m., a.m. 3 a.m. to 5 a.m. Did I say p.m.? Sorry about that. 3 a.m. to 5 a.m. lung, not p.m. If I was saying p.m., I'm sorry. That's my mistake, all right? So 3 a.m. to 5 a.m. That's yin shi lung. And jump to the blood and qi, go finish the lung, and then go to the next meridian. And next meridian is large intestine, which is 5 a.m. to 7 a.m. Lung and large intestine is barely relationship. Now 5 a.m. to 7 a.m. when it finished this, it jumped to the next meridian, which is stomach meridian. 7 a.m. to 9 a.m. And the 7 a.m. to 9 a.m., it jumped to spleen meridian. That's 9 a.m. to 11 a.m. Now you see, stomach and spleen, both are earth. they next together. And lung and large intestine, metal, next together. Right? So when qi and blood go through spleen meridian between 9 a.m. to 11 a.m., you're going to jump to the next meridian, which is heart meridian. It's between 11 a.m. to 1 p.m. And now it's midday. In Chinese called 午时. Yeah, and also yin and yang organs. Then when you finish heart meridian, you jump to the next one called small intestine meridian, which is 1 p.m. to 3 p.m. Small intestine. Then a jump to the next organs called bladder meridian between 3 p.m. to 5 p.m. Then further on, when it finish, the qi and blood finish bladder meridian between 3 p.m. and 5 p.m., it jump to kidney meridian. That is 5 p.m. to 7 p.m. Then finish those 2 hours and finish, and it go to the next one called pericardial meridian. That's between 7 p.m. to 9 p.m. Then finish 9 p.m. from 9 to 11 p.m. That's triple burner. Then further on, gallbladder meridian between 11 a.m. to 1 a.m. All good in here? Okay. Now, all good. Thank you. Yes, thank you. Now, for those you don't know what's going on, right? I just show you. This is from 黄帝内经. Okay, all good. Let's jump to the next one. Now you know. On this circle, it's talking about 12 meridian. And look, 12 meridian cover this person from the top to the bottom. Right? We all have 12 meridian in here. Make sense? Now, if we all have 12 meridian in here, and we named all those 12 meridian using organs name, which means all this direction, different direction. If you treat organ, you treat that too. Are all organs in this map? Yes. So make it so simple. If we put this map on Bai Hui point, you can use Bai Hui point to treat entire body, meridian, as well as organs. Now you know Bai Hui point 220 can treat the entire body. It can treat 12 meridians. Does it make sense? Now I'm going to show you how the map locate on the Bai Hui point later. Let's keep going. Now, how Bai Hui point could treat the entire body and all disease. Because all disease, according to Chinese medicines, is all from the imbalance of organs. Any of you disagree with me? If you agree with me, please reply 2. According to Chinese medicine, all disease cause from the imbalance of the organ. Doesn't matter whether you have cancer, you have diabetes, you have injury, dementia, anxiety, depression, you always be able to find the organs imbalance. And that's how we diagnose. All diagnoses come to organs. Yes, I say cancer. Everything. When it comes to Chinese medicine, you need to diagnose two organs. Make an organs diagnosis. Now, doesn't matter which qi or organs. Qi imbalance in organs. Yes, yes, yes. Everything related to the organs. Now, if it's not related to organs, you can look at the pain. If pain, obvious pain, then you can look at the pain and which meridian does it involve with. Now, if you know the sick meridian and which meridian, then you'll be able to target the meridian. If you know the organs imbalance, you'll be able to target the organs. And how do you target it? Using this map. How about pancreas? Pancreas, spleen, and stomach function. Right? And pancreas is in this area. If this pancreatitis pain have in here, then you're going to have a look what meridian run past here, and then you can make a meridian diagnose. And if people have pancreatitis, the inflammation in pancreas, they may not necessarily have pain in pancreas area. They will have pain over in the back. It may be bladder meridian. It may be gallbladder meridian. Does that make sense? Heart. You can treat heart meridian because heart meridian connect to the heart. But if patient has heart problem, but the pain presented in here, and that stomach meridian in here, that is kidney meridian in here. So you treat those two meridian using the same map. All right. Let's go to the next one. How by Hui point to relieve all 12 meridians. I'm just showing you all this 12 meridian, and here I'm going to show you how to put the map on by Hui. Then when you start to treat by Hui, you need a different direction. When you go to different direction, which means you go to different meridian. Okay. Okay. Now pancreas is in the area. Right? Why would pancreas, the organs, be gallbladder? Because when pancreas issues happen, it may not have pain in the stomach. The pain is actually presented on the back. Okay. So have you seen people have heart problem, but they don't have any pain in the chest area? They actually have pain in the neck. That's refer pain. I just had a patient have pancreatitis, and a few years ago I have another patient have pancreatitis, and the pain is actually in here on the stomach area over here. But this patient, he didn't have pain in the stomach area. He had actually pain in the low back. Went to the hospital emergency, pancreatitis, inflammation in pancreas, the pain presented in the back. Very different. When pain presented in the back, how do we diagnose it? We use meridian to diagnose it. right? If a tumor, brain tumor can cause headache, and brain tumor cause headache on one side. It can be the whole head. It can be just eyes. It can be just an eyes. I don't care about where it comes from now. I do care about the symptoms. Right? You're treating brain, you're treating the actual organs as well as the symptom where it actually related to, involved with. Does it make sense? Because of the head tend to bleed than other parts when needles. It is okay to needle by way for stroke victim with a lot of bleeding problem because taking blood thinner and has nose. Okay, I can't bleed 3 times a day. All right, that's no problem at all. I have patient on warfarin, and I can still put needle on them, an aspirin, a heart problem, and I just letting the patient know that, and they know it, they get bruised easily. Body acupuncture, they get bruised easily. It's not going to kill them. Just explain to them before needle. And when they bleed, you just use cotton ball and press it there and tell them that because you're on blood thinner, I'm going to press it for longer to stop the blood. And they all understand it. Explain communication. Let your patient know what's going on. Need more concentrate over the actual site of pain, be it referred. Now, doc, if the patient comes with a lot of symptoms and they are coming from relief for pain, then you're not just treating the actual organs. You want to treat the referred pain. You want to treat the symptoms as well as treating the organs. Which organs causing the problem? Then you want to treat the organs as well. Okay, I'm not here to teach you how to diagnose because my diagnosis is so different with you guys. But I'm here to share by Hui point 220, and you can use your own diagnose to apply this method. Okay, then what happened is I'm going to show you how I diagnose with pain conditions. Okay, I'm going to show you some example. The relation from heart to neck pain, how is the way? You Google it. That is one of the heart conditions. The heart condition happen, it can be on your face, jaw pain, not necessarily just chest pain in here. Okay, and it can be numbness. Now, I have a live video every morning, 7 o'clock. Eric know that, and I go through all disease every morning. To start it, like we're talking about, what do I talk about today? This morning, angina. We're talking about angina. What's angina? What causes angina? How to diagnose angina, according Western medicine and Chinese medicine, and how to treat angina, Western medicine, Chinese medicine, acupuncture, acupressure, and lifestyle change for angina, how to change your diet for it, how to maintain how stress causing angina, all this thing. So we step by step. Now, if any of you are not quite sure why heart attack, heart problem will cause pain in here, you may have to join all my live video every day. I explain in there. Okay. Now this is the mat in Chinese. Okay, this is the mat for you. Look, you're familiar with the mat just now, right? This one on the right side. I'm not sure about cupping on by waypoint. You can try it. I never tried. Okay. So this map, we know all the meridian. We know all the meridian match with 12 earthy branches. And then we're going to put this map on Bai Hui. This is how we're going to put it. So this is the mat on Bai Hui. So the center point is on Bai Hui point. The center point is Bai Hui point. Okay? You get me? Which means the heart is in the front. Your nose. This is your heart and here. In the back over there, in the back and here. Where about it? This is gallbladder. The gallbladder is in the back of your neck, pointing to the neck. Okay. And what about kidney? So kidney opposite large intestine. Okay. If you look at your patient, your left side is kidney, which is patient right side, right ear is kidney. Your right side, patient's left side is large intestine. That makes sense? Okay, I'm going to repeat again. The heart meridian is located pointing to the front, which is your nose. And opposite the nose is the neck. And that is what? Gallbladder meridian. Gallbladder meridian. Okay. Let me go through. Okay. Then your left side, if you're facing your patient, you're face to face to your patient, right? Your left side, which is patient's right side, is kidney. Now we're talking about this cross, okay? And over that side, which means your right side, patient left side is large intestine. Make sense? Okay. Now you don't want to ask me all this other question. Right? You want to follow me because we don't have much time. We only have 1 hour. When I finish all this, you may have the answer for your question already. Okay, I'm gonna show you how to treat. But first, follow my step. Follow my step. I've seen your question, but I know when I keep talking, teaching, and you're gonna get your answer, what you need. So I'm sorry, I'm not gonna answer you right now. But if I haven't answered you later on, if you still not understand what I'm talking about, you haven't got your answer, and I will give you answer, please ask me again. And here, do you understand at all? Any of you want me to repeat? Now, if you understand it, please reply 1. And I can go to the next. Okay, good. Now we're all on the same page. That's great. Pretty simple, right? Pretty simple. Very simple. Hi, happy day. Very nice to see you. I recognize you very well because I meet you every morning, and Eric as well. Okay, now let's go to the next one. Okay, the next one's easy. Okay, and here, let me ask you, a circle, how many degrees in a circle? I'm going to talk about the ankle and depth. Donnie, 360. That's great. 360. Now, my next question, you're going to find your answer yourself. One circle is 360, right? Let me ask you a question. Now, we have 12 organs in here, which means you have a cake. You have 12 people. How many degrees that you're going to cut the cake? 30. Now you know my question already. You knew it. 30, right? Yes, 30. You see 30. So any question of you? 12 meridians. Each meridian has 30 degrees. And all 12 meridians together, that is, it become 360. That's right. Bang, that's it. That's the image. So let me put it simple for you. All meridian is a triangle of 30 degrees. It seems a triangle, right? Yeah. Simple, right? Do you all get it? If you don't get it, please reply 2. Because I want to make sure you get it. If you get it, 1. Reply 1. If you don't get it, reply 2. And I'm going to explain it again. Because I want to make sure you get it. If you don't get it, I go to the next. It's going to be more confused for you. I don't want to confuse you. I want you really to get it and use it tomorrow. I want you to apply it straight away. No, okay, good. Someone said 2. Don't be shy. I'm going to explain it again. Okay. Now this is a circle, right? The circle is 360 degrees. Right? I haven't got a pen, do I? Let's have a look. Oh, I'm looking for things that I can write on. Just give me a minute. Gonna get something. Okay. This is 300 degrees, right? I'm going to draw something. Wow, it's a bit difficult. Oh, too many. Not very good with drawing. I failed. Not very good. Okay. Anyway, I'm saying that if what I'm saying is this is 300 degree and one, let's say this is a heart, okay, and this area is 30 degree, and the opposite heart that is what, gallbladder, and this is 30 degree as well. Does that make sense? Yeah, 30 degree pizza. That's right. That's what I mean. You have a pizza, but you have 12 person to share the pizza. Each one get 30 degree pizza. Does it make sense now? Nahala. You have a cake, 360 degree, but you have 12 person to share this cake. Yeah. Does it make sense? Nahala? Do you get it now? If you do, please give me a thumbs up or reply 1. Okay, good. Happy day. Don't you understand it? So this is 30 degree for each organs. Okay? I'm gonna do this. Well, you have a pizza, happy day. Then you have 12 person. A pizza is 300 degree. And if you give it to 12 person, how many degrees of that pizza that you're going to give it to? Each person equally. 12, right? 30, right? 30 times 12, that is 360. Yeah, that's right. That's what I'm saying. This is a circle. You put it on top of your head. And the top one is pointing to the back. That is gallbladder, meridian. And that's 30 degree. Pointing to your nose, that's 30 degree too. Pointing to the side, 30 degrees. Pointing the other side, 30 degree. That's it. That's what I'm talking about. Yeah, 12 triangles. That's what you need to know. All right, let's move to the next. Scalp acupuncture technique. Wow, it's a triangle, right? So I call it the fan technique. Cover the triangle If you want to needle, let's say, as in here, you look at the patient and the patient have pain in the heart meridian, and how do you treat heart? Needle over here. This is heart. So you can needle in here. There's a green one, you see? There's your needle. So you can put one needle in here. You can needle. You can cover the whole area, 30 degrees. Cover the whole area. Or you can just do one needle in the middle. Now, you do one needle in the middle, go in, and pull it out, and go to the side. Okay? Just one needle each triangle. You can do more if you wanted to, but I normally just do one. The needle should cost $2.20. I'll answer that for you later on. So look at the triangle in here, the fin. You can put one needle, you can put two needles, you can put three needles, and it's up to you. I normally just do one. I'm going to share with you direction. This is the scalp acupuncture technique. A1. Now, let's back to before. Okay, back to that one. Do you see this on your left side? 11 a.m. to 1 p.m. that's hard. What is the opposite? The opposite is 11 p.m. to 1 p.m. It means heart meridian can treat gallbladder meridian. Gallbladder meridian can treat heart meridian. Doesn't make sense. Now I'm going to show you how to diagnose right now. If you have a patient come to you and they say, well, I have pain in my wrist. And where is the pain? Can you show me? And they show you, oh, pain's over here. What meridian is that? What meridian is that? Heart meridian. Yep, that's it. Your diagnosis finished. Then you're going to treat. Now, which meridian you're going to treat? You're going to treat heart meridian, right? So where are you going to needle? You're going to needle here, the heart meridian, right? Now, question. If I'm not treating heart meridian, can I treat gallbladder meridian instead of heart? Can I just treat gallbladder meridian? Yes. Why is that? Because gallbladder meridian is the opposite meridian of heart. Any opposite meridian of that organ is treated too. Right? This is system 4. Yeah, system 2 as well, but system 4. The opposite meridian. Make sense? Chinese clock opposite. Because they share the same time line. It's just PM and AM mess up. Okay? Now, of course, if this patient come here, pain over here, then you can put one needle on the heart. If you only able to use one needle, you can put needle on heart, or you can put needle on the gallbladder. Either one. Now, if you say you can use two needles right now, you can use first needle on the heart, second needle on the gallbladder. Or you go first needle on the gallbladder, second needle on the heart. And it's up to you. Pointing to the center. Yes, that's right. I'm going to say that. I'm going to tell. Does it make sense? Does it make sense to you? Are you following? I'm going to show you how to, the direction. There's a few different techniques in here. The principle in here is, if the problem is in the heart's in meridian, we use in, the principle, we use in to treat in, which is use heart to treat heart. Now, can I use yang to treat in? Yes. When I use gallbladder to treat heart, they call use yang to treat in. Okay. Next. A1 is the needle techniques of the scalp acupuncture. You only needle from here toward to Bai Hui point. Now you're going to ask me, how big is the circle, right? Is it one of your questions? How big is the circle? The circle can be that big. It can be that big. It can be this. Now I'm going to confuse you now. I'm going to confuse you. Are you confused now? So when you needle it, I normally just use the length of my thumb. From here to here, this is the length. Okay, this is the length. As long as it's in the pie, yes. So the circle, I use 15 mm times 0.16 mm needles. I use 15 mm times 0.16 mm. Okay. Very thin, yes. You don't need to make patient painful for that technique. Okay. The A1 technique, think about if I'm using just this far, I'm using 15 mm needles. From here, go there, stop in here, stop in the middle. The middle of here is Bai Hui point. Okay, so I'm going to use from here, stop in here. That's it. Right. A1, the needle doesn't cross 220. The needle stop in 220. Okay, that is treating kidney meridian. A2, now you're allowed to use two needles. Again, the needle doesn't cross 220. Now, if the patient have pain in the kidney meridian, you needle kidney, and then you needle the opposite side of the kidney, which is large intestine, and two tips of the needle joint in the 220. That's it. Okay. B1, a different technique. The needle actually crossed 220. So one needle, 2 meridian. One needle, 2 meridians. So this is using, you lead the qi from the yang to the yin, from the yin to the yang. That is the principle. Do you know what I mean? So I'm saying that you lead the qi from the du to the, from the yang to the yin, from the yin to the yang. Does that make sense? If the pain is on the large intestine meridian, that's your diagnosis. Then you needle from the kidney meridian, cross by Hui 220 to large intestine. So between here, you go there, you cross by Hui point, then go through large intestine. You lead the qi from in meridian, which is kidney meridian, to large intestine meridian to treat large intestine meridian. That's it. One needle, 2 meridian. Healthy meridian to sick meridian. That is right. Yes, I'm happy to repeat that. The length and the thick. The length is 15 mm, 1.5. Let me type it in. I'm 0.16 mm. That's the needle I normally use. Now I've seen my my colleagues use .20. That's the length. Any kind of length you can use for. So when my colleague used 40 mm times 0.25, and she was actually using A2 and A1 technique, which means the circle is much bigger. And you don't need to do that. And it's up to you. It doesn't matter how big the circle, as long as you get to the Baihui point. Here's another one, B2 technique. The B2 is you put one needle from here, cross 220 to the other side, and you put another needle from the sixth meridian, which is the last intestine meridian, cross 220 to the other side. Okay. And you can do that. There's no wrong or right. You do that to multiply the power, qi, and to make it more powerful. Now, B1 links more. No, same thing. You just cross. You don't have to use longer needles. No. Okay. Now, if you want a needle across, you want to needle scalp acupuncture. What's the angle? 45 degrees? Scalp acupuncture, you don't do 45 degrees. Pretty quick, you're gonna jump onto the scalp bone. You do it less than 10, then you'll be able to go through. Less than 10, then 15. What is the best way for me? I like to use B2, B1, B2, cross. Less than 15, okay. A3. Are you familiar with Magical 12 of Dr. Tan, Dr. Richard Tan? Balance method acupuncture. Are you familiar? Yes. Good. You're familiar with it, right? Okay. Don't worry if you're not familiar. Let me show you. Now with Dr. Tan's method, balance method acupuncture, okay, then what we just show you, if the meridian in here, if the meridian over here, the 6th meridian is kidney meridian, look at here, is the kidney meridian, and you needle kidney image, kidney meridian, that is system 6 according to balance method acupuncture. All right. Then if you're using the opposite side to treat the 6th meridian, which in this case, you were using kidney meridian to treat kidney, right? And that's system 6. And if you're using large intestine to treat kidney, that's system 4. Now, 6 system, you're using 2 systems to treat this person. There are other systems that if you know balance method acupuncture, you can apply it on here too. You can apply it on here as well. Okay. If you're not familiar, that's okay. I'm going to show you a way that you can get familiar later on. Now, with Dr. Tan's balance method acupuncture, it comes with Magical 12, which means if this person comes with, oh, I have pain over here, shoulder, and you have a look, oh, okay, the pain is actually involved with lung meridian, heart meridian, and large intestine meridian. And they say, oh, I also have pain on the opposite side of elbow. And the pain is actually on pericardium meridian and lung meridian in stomach, large intestine meridian. And they say, oh, okay, I'm showing knee pain in stomach meridian, kidney meridian, and bladder meridian, and gallbladder meridian. And also have pain on here, ankle, which is on liver meridian. Okay, what does it mean? This patient has pain involved, in all 12 meridians. This is how I diagnose it. Okay. This is case 1. What about case 2? Case 2 comes with a patient with tummy pain all in here, with headaches all around the head, and tummy pain as well. Right. And diarrhea. Or let's say this case, patient have pain all around the head, all 6 meridian, right? Foot 6 meridian, and diarrhea, stomach and spleen problem, and night urine, kidney issues, right? Gallbladders, liver issue, what? Grumpy easily, stress. Now, in this case, the organs involved with spleen, involved with kidney, liver, and the headaches involved with all 6 young meridian. Then now you'll be able to use Magical 12. So those two cases that we just mentioned, be able to use Magical 12. Insomnia can be heart problem. It can be any others. And how do you diagnose it? Use your same diagnose. If you say, well, this insomnia is actually from the stomach, then treat the stomach. How do you diagnose it? Again, I'm not here to teach you how to diagnose. I'm here to share this method. No matter what diagnosis you pick up, go back to the meridian, go back to the 脏腑 organs, then you'll be able to apply this. Okay. Now, with 12 magical point, magical 12, that on the body point, you can make it into 百会, 12 needles on a different from different direction, pointing to 百会 point. That's it. And it helps. Okay, so normally I put my my thumb in there. So from the side, one needle, and then opposite side. From patient, from the nose, from the front to the back, then the back to the front, pointing to 百会. Then when I go 4 needles like this, across, right? Then what's next? So in this area, I'm going to put 2 more needles in here. And over here, I'm going to put 2 more needles like this. I've got needle in here. I'm going to put 1 in here, another 1 in here, and 1 in here, 1 in here, 1 in here, 2 in here, 1 in here, 2 in here. So you got 4 needles, right? If you look at here, I got 1, 2, 3, 4 needles right now. 1 needle in here, 2, 3, 4. Then there's another 8 needles. 1, 2, 1, 2, 1, 2, 1, 2. 12 needles. The blue and black doesn't mean anything. And what's the meaning? Because I turned the picture, then there's no meaning at the moment. It's for meaning young meridian in meridian, but it doesn't mean anything because I turned the picture last night to make a match to everything. Okay, it's 12 magical point. Another way to needle it. Cross all the needle from one side to the others. Cross to the others. I use this a lot. So with A3 and B3, I use B3 most of the time. Can we balance 12 meridian to cure all lines? Yes, you can. But when you needle all of them, you lose focusing. You lose focusing. To go with diagnose. If there is nothing wrong in the heart, why do you put needle in the lung, in the heart? You know, focusing on. You put needle because you know what's going on, because you have the diagnose. Don't waste the needles. Because when you treat the needle, you put the needle in without knowing what's going on with that, without diagnose, don't do it, because you just separate the power to other area. You know, it was working well with just one needle, and you put another needle, which that needle didn't actually power up the first one. Why do you do that? Don't do it. No, you try it yourself. It's easy. It's easy to needle it. So sitting up is easier, but the first time for acupuncture, sitting up is difficult for you. And then you can needle very beautifully like flower of 12 needle on Bai Hui. Okay? Now we know 220 can treat everything. Do you believe it now? Do you know how to use Bai Hui 220 to treat every meridian? I asked one of my colleagues. She said she used other method to treat the patient. When the result's not good, then she started to put 12 needles. Bang. They got relief. Or when the patient comes in a lot of pain and you don't know where to go, where to do, 12 needle, bang, relief. Can we treat pain in 2 meridian too? Yes. So where's 2 meridian? Good question, Irene. Where's 2 meridian? 2 meridian is with GB meridian, gallbladder. And where's 1 meridian? 1 meridian is with heart meridian. Simple. Okay, I know you have some question. I lost your question. 8 principal diagnosis. Yet you can use 8 principal diagnosis. Hey, Dr. Tan didn't put 12 needle on Bai Hui. I did. Can we balance 12 needle keyword online? Can we treat lower back pain with 12 meridian? Yes, you can, but not treating 12 meridian. If the lower back pain is just an UB meridian, or if it's UB meridian, you treat UB and then you treat the opposite side of UB, which is lung meridian. If the back pain is on GB meridian, you treat GB and you treat heart. That's it. Of course, there's other you can treat too, according to the diagnosis. If the back pain is not just UB meridian, it's actually causing from the kidney, then you have to treat kidney as well, based on your diagnosis. How do you diagnose this case? This is not difficult or needle across 1 point. No. When we say over 1 point, cross 1 point, it doesn't mean all needle really go to 1 point. It can miss a bit, doesn't matter. So 220 is not a point. It's an area. It's an area. It's not a point. Although we said it's a point. Cross means overlapped. Yes. Overlapped. A3 and B3, the needle parallel to each other or on top of each other or arbitrarily choose which needle is on the top of bottom. Doesn't matter. Simone, doesn't matter which on the top. Doesn't matter. There is no order. There's no order. You must do this one before that one now. Eric said, can you create a webinar on the way you do diagnostic? Okay. Now, the way I do diagnostic is pretty similar to you, but I do my own one as well. Yes, we can talk about this. It's not difficult at all. It's not difficult at all. You use all your technique from your school, and then you use pose. I use pose a lot. In my workshop, I teach post-diagnosis. I mainly use post-diagnosis. Okay. And I still look at the tongue. I still look at blah, 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 blah. When there is a lot of other symptoms, I pick up which meridian is it, and I treat the meridian as well as the pulse. How to treat kidney insufficiency. Yeah. Kidney insufficiency, it doesn't make any sense in here. In doesn't make any sense in this part. Only kidney makes sense for me. Okay, you only use meridian and kidney organs. You don't use yin and yang in this at the moment. Okay, you don't do this. Right, apart you from pulse, you can tell which one is strongest, which one is the weakest, and you'll be able to do some treatment in here. Okay, but yin yang deficiency doesn't mean anything in this treatment. You can use other treatment, combine this one. What about in arthritis case? Can one needle the 12? Yes, arthritis, a lot of meridian use magical 12 on Bai Hui. It's gonna work very, very well. Can this treat skin disease? Yes, you can treat skin disease, no problem. But it doesn't mean, you know, we put 12 needle, it can treat everything, right? It seems that in theory, it can treat everything. But you still need to combine other things, okay? You needle it, you ask the patient and see how they feel. You see how they feel. If the pain's still there, what do? Stimulation. Get the needle out and go cover the area, the image, and it'll work better. If you cover the area, the patient still have pain, while you stimulate the needle, you ask patient to move the hand. Third things. Toward there, if the patient still feel the pain, you stimulate the needle in and out, or twist the needle, ask the patient to move the shoulder. That's it. So needle it, bang, no pain. That's it. You don't have to do anything. If the patient say, oh, pain is still there, what do? You can add another needle, insert extra needle from the opposite side, and ask the patient to move again. Gone. You don't have to do anything. But if pain still there, and what happened? You can stimulate a little bit, twitch the needles, or in and out, or simply cover the image of both, and ask the patient to move. It's gone. If you cover the image, the pain still there, in and out the needle slowly, and ask the patient to move while you in and out of the needle. Stimulation on the needles. Okay. And the patient says it's gone. That's great. Right. That's it. So step by step, all this technique you can combine it all together. Do you feel for us or hollow, shu? Don't know about that. Or raise, shear area within the pine? No, you don't have to feel anything. The only thing that you need to feel is get to the Bai Hui point, and according to the map, you do this. That's what I do. You may be able to find more. I'm not quite sure. You experience it. You let me know if you have found anything. If you find anything. Same method for excess and deficiency. Yeah. Yeah. Did you have success with tinnitus? Yes. I just treat lost hearing. No problem. But tinnitus, not just using it, the tinnitus is a very difficult case. Yeah. It can cause from the neck. Then you need to treat the neck. Trigger point is very good for tinnitus, some of the case. And sometimes you need to treat the organs. You know, not just using Bai Hui point can treat tinnitus. I'm not saying that, but you can get results from it. You need to combine others. Well, someone just copy and paste. Would the medical aid work also this way? Yes, medical aid will work in here, but different mat. The needle on top and bottom bases and not parallel to each other, right? Not polarized. It can be bottom and on top, you know. And it doesn't matter with this. It's not actually go through one point. It doesn't matter. You won't hit that. You won't target all needle in one point. Not possible. Not possible. I can't do that. I will miss a little bit. Doesn't matter. As long as it's still on the pie. So on the pie area, still as long as it's still on the image of the meridian. That's it. That's good enough. You know, I'm not talking about straight line, you know. I'm talking about you're going to cover all the needles. If the 12 meridian, you're going to cover the needle on the pie, on the 30-degree pie. That's what I'm saying. And it works. For pain condition compared to Szenan-Balance, which work better? This one or BN? No, I'm not going to answer you this because sometimes you may find just one needle, it works fantastic. Sometimes you need to add more needles on that. If you ask all this question, this is a pretty silly question, to be honest. Why is that? Because no one can tell you. If I'm telling you that Dr. Tan's method in this point will treat back pain, but that point will treat back pain as well. Which one work better? I don't know. You try it out. Because in my experience, I may use this point, work better for back, but the other, they use this point, work better for pain. No comment on this one. If you're saying that, well, this is going to work better for back pain or this is going to work better for back pain. Some cases, this is better. Some cases, this is better. So we don't need to know which one's better. You figure it out yourself. You treat that one, work for that all the time, but this time doesn't work with that one, you add one more tool. This is another tool for you. You can combine this to any method, or you can use this, to needle it. When the pain's gone, you don't have to use any other needles. If the pain's still there, go back to how it was. What other method, whatever the methods that you want to use. Does it make sense? Can one needle all the meridian in stroke cases? Stroke cases not that easy. You can use it and you can combine the other. Where did it come from, Dr. Tans? For this one, well, I learned a lot. And I think many years ago, when I applied Dr. Tan's method acupuncture, and I was thinking, well, 百会 220, everyone said that it can, in my knowledge, it can treat everything. But in reality, you always combine other points to treat. You always combine other points to treat certain disease. You don't use it just alone. And certainly you won't use it alone for knee pain. You know? And sometimes you needle and the patient feel better, sometimes not. And how do you get it more accurately? Then I put the map of 植物留住, this map, on the 百会 point. And I needle it. It works. And I still combine this method with other method. Okay. Then what happened? Recently, I think in the end of last year, then in the end of last year, or beginning of this year, I can't really remember. And I keep thinking, well, can I do magical 12 in here? Since I found that it actually working for each individual meridian. And I did that, and it happened. It works. So I share with you guys, and some of you have been using it. Can I do 12 meridian for someone who is not sick, just to stimulate and increase energy? Yes, you can do that. You can do that. Now, for someone, I haven't seen anyone as perfect in my life. Not everyone's perfect. If you look at it, they don't have symptoms, that doesn't mean that they are good, they are perfect. If you know pose, you can pick up. I haven't seen anyone with a perfect pose yet. What I believe is it is just a needles. We still need to pray for healing. Now, you know the direction, you go for it, and you hit the point. Whether it is 12 needle or just a single one, healing will come if you believe. When you hit the point, it will work. Same as Dr. Tan's method. Okay, I teach that too. Okay, so most of the time we get instant relief, but not 100%. No one would tell you it's 100%. Right? Because in my clinic, if we get structure issue, you put needle in, even with Dr. Tan's method, some cases it doesn't come with relief at all. Any other method are the same. You may get 99% out of 100, but you may get one that have no results. Overlap, yes. So in this theory that you can see that I just show you, which means headache, neck pain, upper back pain, hip pain, knee pain, shoulder pain, elbow pain, ankle pain, wrist pain, hand pain, any pain, depression, anything that you can use Bai Hui to treat. Okay? Only from my experience, I would never really use this with a patient on the first visit. Build rapport with your client first. Have seen many patients who are afraid to have needle on their head. If you use this on a patient first visit and freak them out, you may never see them again. Just my thought. Yeah, that makes sense. But that's you. Okay, that's you. Okay. Now, Aaron, if you talk, what about those patients, those doctors, those acupuncturists using only scalp acupuncture? It comes with communication. It comes with talk to the patient first. Ask the patient, can I needle your scalp? I have a method, blah, 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 blah. Make me comfortable first. If they say, okay, they needle it. If they show you that, oh, really, scalp? If they show you they're afraid of scalp acupuncture, don't do it. Use others. Okay? Any disease that you can use. This is another way for you to treat, right? And when you learn 220 in this method, I'm not asking you only use this. I'm asking you, this is another method that you can apply for, right? Don't give up whatever you've learned. Don't give up anything because of this. I'm not asking for this. I'm here to share with you. There's another tool in your toolbox, and you can use it. You're not happy. You're not happy with it. You can leave it. It doesn't matter. So you can leave it for half an hour, 20 minutes. Use it for overnight, 1 or 2 hours, up to you. But I won't recommend you leave it for overnight or few hours. Get patient. We ask patient to take it home and they get it out, remove it themselves. In some cases, not all the cases, and I don't recommend you do that because they have to explain more, and you have to get patient to sign consent form, and that's what we do. In practice, do you tend to combine it mainly with other body points, or have you had cases where you use solely by way acupuncture? Okay, I tend to use this with other method. Okay, other method, and I do use it for just this for my colleague because it's simple. Okay, neck pain blow-up, we just needle it. That's it. And sometimes I will use this and just leave it for a while and come back and see how everything going. If everything's good, then just do one. But I won't do this because I always go for pose. I take the pose, I needle it, and I take the pose, I balance the pose. Or I balance the pose and the patient still have some pain in there, I add on this one. So I always combine it. For my colleague, you come in, my colleague wanted, and they still need to see patient, and my manager still need to work, and that's the best way to go with. And they come in, neck pain, right? I put 1 or 2 needles. That's it. Well, where's the pain? Pain reduced or pain's gone, and go back to work. That's it. Okay. 220 can treat hypertension and hypertension. What would the difference in needling be? I don't know. You tell me. What's the difference? You tell me. For me, there's no difference. I haven't using 220 to treat. I've used it for. There's no difference. I do it for high blood pressure, low blood pressure. I don't think I have ever used 220 for low blood pressure because I haven't got this patient in my mind. I don't think I have any. Okay, but high blood pressure definitely. But I don't think there's any difference because I'm treating 12 meridian anyway. Cupping, I never try. I don't know. And I've seen that in China. I've seen my master done it, but you have to, get all the hair out. Remove all the hair. Numbness, shoulder pain, yes, you can. Can we use 12 meridian for stroke? Yes, you can. Okay, let's keep going. Now, there's 10 o'clock now. The last thing in here, I hope you enjoyed the last thing in here. I hope you enjoy whatever I just share with you. As I mentioned, the balance method acupuncture got 6 different systems. So I happen to have a balance method acupuncture webinar. Okay, here's what you would learn. This is all the contents in here. We're gonna show you what is the history of balance method acupuncture, balance method acupuncture 1, 2, 3 concept, and what's the image, what meridian, treat what meridian, balance meridian, and how to diagnose. Okay, the 6th system of the balance method system is all in here, and treat you how to show you how to use one needle, one meridian to treat few meridians, 2 or 3 meridians. Okay, and to show you Dr. Tan's liver point and Dr. Tan's GB point location and needle technique. Then I also give you a case study: shoulder pain, back pain, spine pain, Bell palsy, and head acupuncture, including it in here too. But not the Bai Hui one. The today course I haven't included in there, but I will film another Bai Hui 220 scalp acupuncture, put it into this webinar. So bonus, this is balance method local acupuncture, local balance, but it comes with global balance, but global balance is an advanced class. But I give you bonus of medical aid to treat digestive problem, coughing, lung problem, and bonus of global balance of Tai Yin Yang Ming, Jue Yin Sao Yang, and Tai Yin Yang Ming, Jue Yin Sao, Tai Yang Sao Yin pattern. Okay, to give you all this global balance that you can treat your patient with local balance. Okay, now if you're from New Zealand, we actually have a proof of 9 CPD from ACNZ and NZASA. But if you're from any other country, we'll give you the certificate as well. I'm not quite sure whether your associate will recognize this, but ask before you buy it. Now, this webinar, normally if you attend a workshop, it's going to cost you $500 US dollars. Now online is 2 days cost. It's only $299 US dollars. Okay. But we are going to put up to $399 soon. Yeah. Probably in a few weeks' time, we're going to put it in $399. The great thing in here is you're going to save money. How do you save money? Now, because normally if you go attend for a workshop, you're going to stop working. You're going to pay some money for hotel. You know, you're going to take a flight, something like that. And with webinar, you don't have to do this. You only pay $299, and you can keep working in your clinic, seeing your patient. If you pay $500 to come to my workshop, and you still have to pay others, and you'll not be able to work, right? Then a webinar, you can learn it at nighttime, in the weekend, it's up to you. Therefore, you save money in here, right? So you keep your clinic going, see your patient, and you still learn whatever you want to learn. Now, if you buy this webinar, you have lifetime access to this webinar. You could watch it again and again and again without paying any more money. Now, we have 30-day money-back guarantee, no question asked. If you buy it and you think, oh, this is not for you, within 30 days, you can ask your money back. Okay, so no question asked. Now, for you to attend this webinar, you get a certificate and you're allowed to come into our private Facebook group, ask any of your questions, and I will answer you. Yes. Now the 900 euro, yeah, I know, Donnie. But that is probably 4 days, right? 900 euro. Then, which means 2 days, 450. So our price is 299 for now. In the next few weeks, we're going to put up to 399. Yes, ACNZ and NZSA already approved 9 CPD. Now, this is the sign up page. Click it, and you can sign up. All right. And more further, I promise that I'm going to film another video that to show you whenever you buy this webinar, then I'm going to show you how to needle 220. And I'm going to make another course, put it onto this local balance webinar. So you pay only $299, but you receive another course of $220. How you can treat your patient and all the technique I'm going to show you in there. More than what we're talking about today. For those you have bought, you have ordered, you have paid $299 already. You already are webinar students, and you don't have to pay anymore. I'm going to put this video 220 webinar. I'm going to put some video that how I needle my patient in a real case study for you, and you don't have to pay any more money for it. Okay. When you buy this now, in the future, if I add any contents in this course, there's no extra charge for you. Right? That's it for today. Now, if you want to sign up, please click that now. If you have any question, please, you can ask now. And here is the PDF that you can download. Now, for the rest of you, if you are from New Zealand, then you can leave now. If you finish, if you all good, if you have no question, then when you leave now, you'll be able to get your certificate in our Facebook group. Okay. Thank you very much. So the PDF is in here. You can download if you wanted to. Now, if you have any question, you can ask now. I'm here, available for you. So you guys leave a lot of messages, and I haven't got enough. I'm not quick enough to read everything. I'm so sorry about that. I'm trying my best. That's not it. How do I do this? Oops. Okay. And China use. Okay. Thank you for the webinar. I really enjoy your teaching. Thank you. Thank you very much. Will I get a certificate of participation? Yes, Ali, you will sign up and you will get a certificate. Thank you so much for the presentation tonight. You're welcome. How would you apply this for Parkinson? You should diagnose which meridian, diagnose which organs, then you apply the needles. Simple. Where I will find the certificate, please repeat. I lost the connection. So all the certificates is in the Facebook group. So in the next 2 weeks, Kenny will upload them to it. Okay. You're welcome, Aaron. Thank you for supporting. Thank you, Eamon. Jordan, thank you. Aitang, thank you. Takako, thank you. David, thank you. Thanks you, Szenan. Good new information. Great. Looking forward for the result. I have to leave right now. You're welcome. You're welcome. So a lot of people say thank you and thank you, thank you, thank you. It is a brilliant course. If you haven't done it before, you will learn a really effective method. Thank you, Shonan. Okay. John, always many thanks for your wonderful lecture. You're welcome. Okay, all good. Thank you, everyone. So there's 106 people that download the link, the PDF. Thank you. Do you have any more questions? If you have questions, you may ask now. Okay, oh good. Thank you very much. Now the rest of you, if you haven't, if you can do me a favor, that'll be great, which means go to follow the step. If you haven't done if you're happy to write me a Google review, please go and click this link and sign up with your Gmail account first and click that link and leave me a nice Google review, please. That'll help me a lot. Thank you very much. And then when you finish it, you get screenshot and send me an email on info@acupuncture-TCM-school.com, and I'll send you the link of free magical aid to treat heart disease and digestive disease and respiratory diseases. Okay, what about hernia disc? Okay, herniation disc. I use GE acupuncture to treat it. I use balance method acupuncture. I use acupuncture spirit. I haven't found that one technique can treat herniated disc easily. Okay, but GE acupuncture is the one that I found so far that more effective than the other acupuncture. Okay, GE acupuncture, and I promise that I'm going to show you guys how to do GE acupuncture for herniated disc, and I haven't got time to get the PD to presentation together. I've got it in Chinese, but it's a big job for me to translate to English, and I haven't got the time yet. And I will keep following my Facebook, my YouTube, and when I'm ready, I'll present it to you guys. And that's free. I got the permission from Master Liu, and I'm allowed to share with you guys 4 points for herniation disc issues. Just a quick question. What are the dates for the balance method acupuncture webinar? It's already recording one, so you can, as soon as you pay for it, you can watch it anytime you want. Okay, there is no date of it. It's already there. You pay for it, you can watch it anytime you like. Listen here. Daisy, thank you. I'll see you on Monday, Daisy. I'm not saying choose scalp for this problem. No. I'm saying GE acupuncture. I find GE acupuncture is more effective than the others in the structure and the disc issues. Thank you. Have a good night. You too. All right. I think I should go now if you haven't got any question. And let's leave it for now. Okay, all good. Let's see where is it. Have a good night. Thank you for sharing your bright ideas. You're welcome. I purchased the balance course. Okay, cool. Thank you. Now we will receive your email, and you will receive the email as well. And you go in straight away and get your check your junk mail as well. What is the name of the download? What about Donnie? I don't. What do you want to download for? What sort of download? PDF Finder 220. 百会12真功易课. Okay. Now you should be able to you should be able to access to the platform straight away to watch your the what do you call it? To watch the webinar. Okay, there's no problem at all. You shouldn't have to wait for anything. I'm pretty sure of that. Or you can check your email. And remember to check your junk mail as well. Okay, thank you. All right, that's it for tonight. Stay awesome. Ismail, if you purchase it, let me send you an email. You can talk to me in the email. Okay, I've got your email. I'm going to send you the email. You should be able to access it straight away. Okay, there's no need. You purchase it, how to access it? Use the same link to access it. But I just checked on my platform. Let's see. It hasn't shown up yet. Let me see. Okay, I'm going to close this platform now, and I will email you right away. Thank you. Thank you for supporting. See you. Bye-bye.